Hey everyone, welcome back for another deep dive. You ready to decode some medical and dental terminology with us today?
Absolutely. Should be a fascinating one today.
Awesome. So, we all want to be able to understand what's going on with our health, right?
Of course.
Well, sometimes it feels like doctors and dentists are speaking a whole different language.
Yeah, it can definitely seem that way. But once you break down these terms, it's like a whole new world opens up.
Totally. So let's jump right in. Today, we're going to tackle a mix of common and some not so common conditions.
That's good.
We're going to look at what causes them, what the symptoms look like, and why it's all so important. You ready?
Yeah, let's go.
All right. First up, let's talk about a few big names in infectious diseases. Gonorrhea, tuberculosis, syphilis, and diphtheria.
Okay, good place to start. So gonorrhea, that's a bacterial infection, right?
Yep, that's right. And it can actually show up in different ways depending on whether you're a man or a woman.
Yeah, that's one of the tricky things about it. Men, they'll often have something called urethritis.
Urethritis.
It's basically inflammation of the urethra, the tube that carries urine. And they might have some discharge too.
Oh, okay.
Now, with women, it can be a little different. They might get cervicitis, which is inflammation of the cervix.
And they might even develop pelvic inflammatory disease, or PID.
Exactly. PID is a serious infection of the reproductive organs. It's really important to catch it early.
Absolutely. But here's where it gets really interesting. Gonorrhea can actually also show up in the mouth.
Yeah, that's right.
What would that even look like?
Well, you might see some red or ulcerated areas in the mouth.
Oh.
And the lymph nodes under the jaw, those could be swollen too.
So it's a good reminder that these infections don't always stay put in one part of the body.
Exactly. They can spread and cause problems in unexpected places.
Okay, that's gonorrhea. Now let's move on to another big one, tuberculosis.
Tuberculosis, or TB, is caused by bacteria that mainly target the lungs.
And this one can be kind of sneaky, right?
Yeah. It can start as a silent infection, what we call latent TB.
So you might not even know you have it.
Right. But then it can reactivate and cause some pretty serious symptoms.
Like what?
Well, fever is common. And then there's this persistent cough, one that just won't go away.
And in some cases, people even cough up blood.
Yeah. That's a sign that it's progressed pretty far.
Yeah.
Early detection is really key with tuberculosis.
Yeah, you don't want to wait until it gets to that point.
Absolutely. If it's not treated, it can lead to some serious long-term lung damage.
All right, so we've got gonorrhea and tuberculosis. Now, how about syphilis? This one has always kind of fascinated me. It's known as the great imitator, right?
That's right. It can mimic a lot of other diseases, which makes it tricky to diagnose.
And it goes through different stages, right?
Yep. The first stage, you usually get this painless ulcer called a chunker.
A painless ulcer? That seems kind of strange.
It is. It's thought that the bacteria, Treponema pallidum, actually suppress the body's inflammatory response.
So that's why it doesn't hurt.
Exactly. Without the inflammation, you don't get the pain signals.
Wow, that's pretty sneaky.
Yeah, the bacteria are kind of playing hide and seek with the immune system.
Okay, so what happens after the chancre stage?
Well, if it's not treated, syphilis moves into the secondary stage. That's where it really starts mimicking other conditions. You might see these mucus patches in the mouth or on the genitals.
Mucus patches, what are those?
They're kind of grayish white sores.
Oh, okay.
And there can also be these wart-like growths called condylomatolata.
Condylomatolata, got it.
And then it can eventually progress to a latent stage where it's kind of hiding out in the body.
Yeah.
And then even a tertiary stage.
And that's where it gets really dangerous.
Yeah, in tertiary syphilis, it can attack the heart, the brain, other organs.
Okay, so definitely not something you want to mess around with. Now, last on our list of big name infections is diphtheria.
Right. Diphtheria, this one is pretty distinctive.
Yeah, I remember reading about it and thinking, wow, that's a visual.
Uh-huh. Yeah, it can be. It causes this thick gray membrane to form in the throat.
Yeah. And sometimes the swelling gets so bad it creates that bull neck appearance.
Exactly, bull neck. That's a classic sign of diphtheria.
And it's not just the throat that's affected, is it?
No, it can involve the skin, too. It can cause these chronic ulcers that are really hard to heal.
Okay, so we've covered some of the more well-known infections. Now, let's dive into some lesser-known but equally interesting conditions.
Sounds good to me.
All right. First up, we have noma. Have you ever heard of this one?
Yeah, noma, also called cancrum oris. It's a pretty devastating infection.
It is. It's a type of gangrene that basically destroys the tissues of the mouth and face.
And it tends to affect young children.
Yeah, especially those living in poverty who have weakened immune systems, often due to malnutrition.
Right. It's a really heartbreaking condition, and it highlights how closely linked health is to socioeconomic factors.
Absolutely. It's not just about germs, it's about the whole picture.
Exactly.
Okay, now let's talk about actinomycosis.
All right, actinomycosis. This is a bacterial infection that can cause these hard, lumpy swellings.
Like abscesses.
Kind of, yeah. And often they'll have draining sinuses.
Draining sinuses.
Yeah, openings where a pus drains out. But here's the interesting part. Sometimes the drainage contains these tiny granules that look like grains of sulfur.
Grains of sulfur.
Yeah. They're actually colonies of the bacteria, and seeing them can really help doctors diagnose the infection.
Wow, that's wild. Our bodies are just incredible, even when they're fighting off disease.
They really are.
All right, and last but not least, we have cat scratch disease. I'll admit, I used to think this was just an old wives' tale.
Uh-huh. No, it's definitely real.
So what causes it?
It's caused by bacteria that can be spread through, you guessed it, cat scratches or bites.
Okay, that makes sense.
Most cats actually carry the bacteria, but they don't usually get sick from it.
But humans can.
Yeah. In humans, it can cause fever, swollen lymph nodes, and a bunch of other symptoms.
Wow, so a seemingly innocent scratch could actually lead to a full-blown infection.
Exactly. It's a good reminder to be careful, even with minor animal scratches.
Absolutely. Now, before we wrap things up, let's touch on sinusitis. It seems like everyone I know has had it at some point.
Yeah, sinusitis is super common. It's just inflammation of the sinuses, those air-filled spaces in your skull.
And it can be acute or chronic, right?
Yep. Acute sinusitis often comes from a virus, like a cold. Chronic sinusitis is usually caused by bacteria.
And the symptoms can be pretty varied, can't they?
Yeah, you can get headaches, nasal congestion, facial pain.
And even toothaches, right?
Yeah, especially if it's odontogenic sinusitis. That's when the infection starts from a dental problem.
I see.
And in those cases, imaging like CT scans is really important to figure out what's going on.
Makes sense. Wow, this has been quite the journey through medical and dental terminology.
It has.
I feel like we've cracked a secret code or something. It's amazing how understanding these terms can give you a whole new understanding of your health.
I agree. Knowledge is power, right? The more you know about your body and how things work, the better you can advocate for yourself. So let me ask you this. Let's say you see someone who has a fever, swollen lymph nodes, and they mention they got scratched by a cat recently. What would you be thinking?
Well, based on what we've learned today, I'd definitely be thinking about cat scratch disease. It's amazing how all these terms are starting to make sense now.
That's great to hear.
Thank you so much for this incredible deep dive. I feel like I've learned so much.
It's been my pleasure. Keep that curiosity going. There's always more to discover.
And to all of our listeners, thank you for joining us today. We'll catch you next time for another fascinating deep dive.